All right, let's jump right in. You know, when we think of a medical emergency, things like a heart attack or a stroke probably come to mind first. But there's another, often more silent, killer out there: sepsis. So today, we're going to break down the international playbook for fighting it, the 2021 Surviving Sepsis Campaign Guidelines. First things first, what exactly is sepsis? It's so important to get this right. It's not the infection itself. It's the body's overwhelming, chaotic, and frankly, self-damaging response to an infection. Think of it like this. Your immune system is supposed to be a firefighter. But with sepsis, instead of just putting out the fire, it starts knocking down the whole house. That's sepsis in a nutshell.
And the stakes? They could not be higher. I mean, look at this. Globally, sepsis kills somewhere between 1 in 3 and 1 in 6 people who get it. That is just a staggering number, and it's exactly why what happens in those first few hours is absolutely critical.
So let's start at the very beginning, the onset. The biggest challenge right out of the gate is that sepsis can be really tricky to spot. Its symptoms can look a lot like other, less serious conditions, so catching it early and knowing what you're dealing with, that's everything. So how do hospitals get ready for this? Well, the guidelines strongly recommend that all hospitals have what's called a performance improvement program. This is basically a game plan for getting better and better at catching sepsis. It means actively screening high-risk patients, making sure staff are educated, and having standard procedures locked and loaded to treat it fast. Okay, so once sepsis is suspected, the clock starts ticking loudly. This brings us to the first few hours, which are, no exaggeration, an absolute race against time where every single minute can change the outcome. So if we're treating this as a true medical emergency, which we are, what's the immediate counterattack? What are the very first moves in that playbook?
The immediate response revolves around the sepsis bundle, which is a set of 3 crucial actions that have to happen fast. First, you measure blood lactate. High levels are a big red flag that the body's tissues aren't getting enough oxygen. Second, you start fluids, and a lot of them. We're talking IV crystalloid fluids to help boost the circulatory system, and that needs to happen within the first 3 hours. In third, and maybe the most urgent, get antimicrobials, like antibiotics, on board immediately, ideally within 1 hour. You've got to fight the source of that fire.
All right, so after that initial scramble, the patient is very often in the intensive care unit. And this is where the battle gets even more complex. It requires a whole series of critical choices to keep the body's systems from going over a cliff.
Let's talk about fluids again, because it's not just about giving fluids, it's about giving the right fluids. These 2021 guidelines show a real shift towards using what are called balanced crystalloids instead of just normal saline. So why the change? Well, normal saline is really high in chloride, and that can cause its own set of problems. These balanced solutions are much closer to our body's own plasma, which makes them a gentler and likely safer choice.
Now, when fluids alone aren't enough to get blood pressure back up in septic shock, doctors turn to vasopressors. These are meds that help squeeze the blood vessels to raise pressure. And the guidelines lay out a very clear pecking order here. The go-to first-line choice is norepinephrine. If that's not getting the job done, the next step is to add vasopressin. And if blood pressure is still too low, that's when you add epinephrine. It's a clear step-by-step ladder for a really high-pressure situation.
So if you kind of zoom out, you can see the guidelines are painting a really clear picture of best practices. And it's not just about what to do, like using norepinephrine, it's also about what not to do. For instance, they now recommend against using certain fluids like starches because they can actually increase the risk of kidney injury. And they also caution against relying only on a screening tool called QSOFA. It's simple, sure, but it's just not sensitive enough. It can miss a lot of sepsis cases. The big theme here is a move toward more precise, more thoughtful interventions. But here's the thing that's so important to remember. Surviving the ICU, that's just the beginning. The fight against sepsis doesn't just stop when the patient leaves the hospital. The aftermath, that long road to recovery, is a huge and often forgotten part of the journey. And you don't just have to take my word for it. The guidelines themselves say it perfectly. This isn't a quick bounce back. For so many survivors, recovery is a marathon. It involves all these new physical, mental, and emotional challenges that are often grouped together and called post-sepsis syndrome. So how do we help these survivors? Well, the guidelines really push for a holistic approach. They lay out these pillars of survivorship, talking about goals of care early, giving people clear education about what they just went through, involving them in their own discharge planning, and even connecting them with peer support groups. It's an approach that truly recognizes the person, not just the disease they fought. And all of this leaves us with a final, really powerful question. We have this incredible, detailed playbook to fight sepsis in the hospital. But recovery is a marathon, not a sprint. And it makes you wonder, is our healthcare system really built to support these survivors on their long and complicated road home?